Dengue is a viral infection which is transmitted by the bite of an infected mosquito. Most people infected with dengue have no symptoms. However, it can cause a self-limiting febrile illness, and rarely patients can become severely unwell. Globally, it causes tens of millions of cases each year. It's found in tropical and subtropical climates, but cases have also recently been described in southern Europe, most likely reflecting climate change. All the cases of dengue which we diagnose in the UK are in travellers returning from these regions. You cannot catch it in the UK itself. To catch dengue, you need to travel to regions where it is endemic. This includes more than 100 countries in Africa, the Americas, the Eastern Mediterranean, Southeast Asia and the Western Pacific. And as you can see from the map, Southern Europe is also now affected. Whilst there is low level of transmission of dengue in these countries, outbreaks also occur. Travel during an outbreak when there's a high intensity of transmission will increase the risk of acquisition, as will travel during or shortly after the rainy season when the number of mosquitoes rise rapidly. Dengue is transmitted from one human to another by different species of Aedes mosquito, most often Aedes aegypti. This mosquito breeds in small water containers, often in urban or semi-urban areas, for example buckets for collecting rainwater or tyres. They are predominantly day-biting mosquitoes, so the risk of acquiring the infection is greatest during daylight hours. Most people infected with dengue do not develop any symptoms. In the 25% of people who do become unwell, symptoms start about 5 to 8 days after being infected, often with a sudden onset of fever up to 40 degrees Celsius, severe headache, pain behind the eyes, muscle and joint pains, and a generalised redness of the skin which looks a bit like sunburn. Some patients feel nauseous, vomit and have tummy pain. The fever continues for about 5 to 6 days, and around day 3 or 4 of the illness, a skin rash can develop, characterised by red, sometimes slightly raised spots. Symptoms usually settle within a few days of this rash developing, although some patients do experience more prolonged fatigue. During the recovery phase, patients may also find that their skin peels, similar to the peeling you can see following sunburn. Some people do become severely unwell with dengue. These complications are usually seen in people living in endemic areas, in particular young children and older adults with comorbidities, for example diabetes or kidney disease. Complications are very rare in travellers. This is because severe dengue does not occur with the first dengue infection, but rather on subsequent reinfections with a different serotype of the dengue virus. Recurrent infections are much more likely to be seen in people living in endemic countries who are constantly exposed to mosquitoes throughout the rainy seasons, rather than in short-term travellers. Patients who go on to develop severe dengue start to show symptoms and signs about day 3 or 4 of their illness. Warning signs include mucosal bleeding, severe tummy pain, persistent vomiting, fluid accumulation and liver enlargement. Severe dengue is characterised by bleeding and multi-organ failure, and in some cases, particularly in children, it can lead to death. However, with good medical supportive care, deaths from severe dengue are usually less than 1%. Dengue is very difficult to distinguish clinically from other infections which may also be endemic in these regions, for example, influenza, Zika, chikungunya virus, or even malaria. Therefore, to make a diagnosis, laboratory tests are required. Dengue is diagnosed by looking for the virus itself in blood and/or urine, with the greatest yield from blood in the first 5 days of symptoms. Serology, which is where we measure the antibody response to the dengue virus, can also be used to confirm the diagnosis. We also take other blood tests, for example a full blood count, renal and liver function, to help us exclude other infections, diagnose dengue and assess for complications. Most infections with dengue are self-limiting, i.e. will recover without medical intervention. In fact, there are no specific treatments for dengue, only supportive treatments to manage the symptoms and complications of infection. It is important to ensure that you remain hydrated. Paracetamol can be taken for pain relief or to help lower the fever. However, non-steroidal anti-inflammatory drugs, also known as NSAIDs, for example ibuprofen, Nurofen, naproxen, should be avoided, as these may increase the risk of bleeding. Fever in a returning traveller should always be assessed by a medical professional. Most returning travellers with suspected dengue infection can be managed at home and do not need to be admitted to hospital. However, this decision will depend on the clinical assessment. Prevention of dengue is by avoidance of mosquito bites, especially during daylight hours and particularly around dawn and dusk. Travellers should use insect repellents on exposed skin. DEET-based repellents are considered the most effective and should be applied according to the manufacturer's instructions, which is often more often than many of us do in practice. It should be applied after sunscreen. Wear loose clothing, where possible with long sleeves and trousers. If living in an endemic area, then try to remove any potential water containers or rubbish from the area around the home, as these could act as potential breeding ground for mosquitoes. As of January 2023, a new vaccine has been licensed in the UK for prevention of dengue disease in individuals over 4 years old. The UK Joint Committee on Vaccination and Immunisation are currently reviewing this vaccine and will issue recommendations on its use in travellers in due course.